Well, welcome everyone. I hope you are well. Welcome to the PGC, the Philippine Genome Center Biobank Seminar Series. This is this is our first seminar for the year, and we hope that you will enjoy this talk today. Uh, Today, we have a very special guest with us, Dr. Devis Pascut. I hope I pronounced it correctly. He is a senior researcher in translational oncology at the Italian Liver Foundation. We've been hearing so much really good, um, positive information regarding the Italian Liver Foundation. So we're very, very excited that Dr. Pascut is here with us. Uh, the Italian Liver Foundation is located in the Area Science Park in Basovizza, Italy. Dr. Pascut holds a PhD in molecular medicine from the University of Trieste and has extensive experience in molecular cancer medicine and biotechnology. He leads research projects and coordinating cross-border collaborations in translational oncology, serves as a principal investigator and project coordinator for various initiatives aimed at biomarker discovery and validation in hepatocellular carcinoma and related conditions. Recently, he has been involved in several significant projects, including the development of cross-border biobanking model for translational research studies and enhancing molecular diagnostics of circulating tumor DNA through advanced sequencing methodologies. Currently, the Philippine Genome Center is moving towards biobanking, and several agencies and institutions in the Philippines is also very much interested in moving in advancing its biobanking capabilities, especially after the COVID has happened. Now that we are post-COVID, there's a lot of samples that have stored. We don't know what to do with them. And there's a lot of research opportunities that can be done. Of course, it's not just COVID. There's so many other types of diseases that we are collecting. So without much further ado, we were very much interested of hearing Dr. Devis Pascut's experience in biobanking in Italy. So let us welcome Dr. Pascut. Virtual applause.
Thank you so much for this nice presentation. Good afternoon, everyone. Of course, thank you so much for inviting me to give this speech today. It's a great pleasure for me. So let me share my screen. Please give me a feedback. I hope you can see it. Can you see it?
Yes, we can see it very well.
Oh, perfect. So today I would like to share with you some of my experiences from our activities while setting a liver biobank here in Trieste. So let me disclose that I'm not for sure an expert in the field, but rather someone who gained some experience while establishing a biobank. So our adventure, let's say, started a couple of years ago with this project, Cross-Border Platform for Efficient Management of Biobanks, which was an international collaborative project with involving research institutes, universities, the blood bank, the National Blood Bank of Slovenia, for example, hospitals, of course, the Italian Liver Foundation, and some companies. The aim of this project was basically to harmonize the existing biobanks in the area, as well as to promote the development of new ones. I have to say that since 1996, there was a growing interest, there is still a growing interest in the biobanking, as you can see for many publications in the field, not only scientific publications, but also magazines such as Time, Forbes, that define biobanks as among the 10 ideas changing the world. So they as well recognize the value and importance of biobanks for research and medicine. So I was just mentioning that the term biobank was firstly used in 1996, and starting from that date, there was a growing interest, as you can see, for the many publications, the exponential growing of the publications present in PubMed, for example. And this interest was flanked by an active, sustained funding campaign from the European Union that decided to put a lot of money to promote the spread of biobanks across European countries. Now, most of the biobanks are recognized under the biobanking and biomolecular resources research infrastructure. Basically, it's a sort of infrastructure which is networking all the biobanks in Europe. Usually, I like to showcase this slide just to brainstorm about the term biobank, because the term biobank is composed by the word bio, which reminds you something related to biological samples, can be blood or urine or something else. But in my opinion, the most important term within the word is bank, which reminds you to an institute, a building where usually you put your saving, your valuables. And indeed, for us researchers, biological samples are a gold mine, because we need samples to conduct our researches, of course. And indeed, if you take a look to the main biobanks in Europe and worldwide, they look like some bank vaults. So the parallelism is still there. Why I decided to use the title Biobanks about research in healthcare? So basically because there are many examples. You can go, for example, to this website, which is related to a node of the biobank within the BBMRI, to take a look at the projects that were they started and they were concluded thanks to the resources, the biological resources present in the biobank. Some really important projects, such as COVID-related projects that led clinicians to determine which were, for example, the organs that were affected in COVID, and they found some markers to guide the treatment. And then, as you can see in the slide, many other really important studies. Let me underline the definition of a biobank, one of the definitions of a biobank. The biobank is a collection of biological material and associated data, this is important, voluntarily donated by a group of individuals that are stored and organized at low temperatures for use in research. I usually like to stress also this concept. Biobanks are a service, and they are a service made from the community for the community. What does it mean, this? Citizens, patients are voluntarily donating their samples. The biobank store the sample, collect, store, and distribute the samples to researchers that would like to conduct some important research, and possibly the results of those researches can give, as a result, maybe a new diagnostic kit, biomarkers. So they are somehow promoting innovation thanks probably to the collaboration with some companies that then they can bring the result of research to the market, directly to the market. So, and then this solution goes back for the benefit of the community. So that's the principle that biobank is a service made from the community for the community itself. And this is, for me, a central aspect of how the biobanks works. Of course, to make this principle assumptions work well, you need to create awareness. Indeed, while starting our project, we realized that we needed to invest some time, money, let's say, in creating awareness, engaging stakeholders that are different, can be the donors, can be experts in the fields, can be clinicians, can be policymaker. They are also important because sometimes they don't consider biobanks as a priority for for the territory. So it's important to engage them, create awareness, because then they are really promoting the development of biobank. And when you explain which are the benefits of biobanks, then they can really help you in establishing a biobank in the territory, as we did. So I would like to show you this survey that was published a few years ago. In this report, Biobanks for Europe, a challenge for governance. This surveys was basically done for all the European countries. As you can see, the citizens in the Northern European countries are more confident, so they don't have concerns in donating samples for a biobank. Indeed, I can say that the first biobanks were developed in Northern European countries. Italy, we are here in the middle. So if you go around and ask to the citizens, would you like to donate your blood sample, urine sample to a biobank? They even don't know what a biobank. They don't have really a clear idea. Why should I give a sample of my blood to be stored in a freezer? They don't know why, they don't understand the value. So basically, okay, no, I will not donate my blood samples because maybe it's painful for me, the blood extraction. On the other side, when you ask, would you like to give or let us take some of your data, such as, for example, I can make an example, which are the associated data, sex, age, disease, type, and biochemical data, for example, to be associated to the sample. That was even worse for Italy, because sometimes citizens, they look this with suspicious. So why I have to give, why they have to know which disease I have? So probably they will use this for other purposes. So maybe they, I will be profiled. So they look with suspicious. But of course, if you don't explain why and how the biobanks works, you will not obtain easily samples in a biobank. So that's really an important aspect to be considered when establishing a biobank. So that's why we started a really huge campaign of communication while starting with a biobank project. So we, of course, involving many posts in social networks, radio interviews, TV shows, as well as some surveys that we did for the citizens, and of course, presentations in conferences, workshops, and also some important training activities, which can be also see it as a sort of activity in creating awareness, because you have to know that sometimes even the personnel at the hospital, they don't have really idea of what is the real benefits of a biobank in the territory. So I have to say that at the beginning, when we decided to start the protocol, so we involved the directors of the departments. So we shared the protocol. So we asked them to collect the samples in a certain way. We asked them to enroll certain patients. But I have to say that that system didn't work properly until I did a on-site training there. So, and then I realized that it's really important, the on-site training. So go there, explain really well to the personnel, from nurses to clinicians to the personnel, the staff in the labs, why we are doing this, what's the benefit of collecting samples to be stored in the biobank and then to be shared among researchers to conduct impactful researches, and then can provide results that can be used for the patients that are there in the hospital, that they are taking care. So that is an important aspect, because sometimes if you don't let the people understand why you do this, they don't understand really the value. And so, and for them, it's basically maybe an additional work to be added to the routine activity. So why I have to take other blood sample centrifuge and aliquot? I have still a lot of work to do in my daily activity. You know, sometimes they think, but once you explain why and how, they are more engaged, and then the system really will work well. Of course, before doing the training activity, you have to think that you have to define what are your standard operative procedures. So basically, we spend really a lot of time in defining the standard operative procedures for our biobank. I have to say that this aspect took for, I think, more than 1 year, for 80% of the SOPs. And that's really important, because in the SOPs, you define how the samples should be properly collected. You define the quality testing, the quality plan, the disaster plan. You define how the samples, which samples can be stored, how the samples can be distributed. You have to define the committee deciding which is the project that can be let's say enrolled in the collaboration with the biobank, of course, because of course you cannot give the samples to everyone is asking the samples. You have to define which is let's say the most impactful research project, and you have to define the SOPs after you take into consideration the aim and scope of the biobank you are trying to establish, after you understand if the biobank in your territory involving the collecting center is feasible, because you have to go there to the hospitals, for example. You have to understand if it is feasible to collect some type of samples. For example, not for all the collecting centers is feasible to collect liver tissues in a certain way, or not for all the collecting samples. You can pretend to centrifuge, for example, the blood sample after 30 minutes from the collection. So that's why it's important to establish a real communication channel between all the collecting centers when starting to understand if what you plan to do is really feasible or not. And also you have to take into consideration all the legislation which is present in Europe or in Italy that you want to take into consideration while preparing your standard operative procedures. I have to say that in Italy, there is not a real well-defined legislation regulating the development of biobanks. So we use some European legislation such as this, which is the biobanking, basically a legislation which is basically regulating the biobanking activity across Europe. So why liver? Of course, we are Italian Liver Foundation, so we focus in the liver, but there are many, many other important aspects to be considered. So consider that a few years ago, cirrhosis was listed among the 20 causes of death worldwide. So I have to apologize because this data was from 2018, but I think that now this is more or less floating in the ranking of those causes of death worldwide. But also consider that NAFLD, or now MASLD, metabolic associated liver disease, is present in the 25, 30, up to 40% of the general population. Consider the high incidence of hepatitis C and B in many countries, and consider that, for example, liver cancer is one of the deadliest cancers worldwide. All those diseases cause 2 million deaths per year worldwide. 1 million basically due to complications of cirrhosis, and 1 million due to hepatitis and liver cancer. So they have really, really a huge impact in our society. This basically is due to still many unsolved issue, what we call clinical unmet need, that can include, for example, the early diagnosis for different type of liver diseases, including liver cancer, of course, the lack of really effective therapies, the lack of prediction model, biomarkers. There are not so many reliable biomarkers. So all those aspects contribute in the really high cost in the management of those diseases. For example, in this publication that this study that was published in 2016, they calculated the costs, for example, in Italy and other countries, United States, Germany, France, and others, for the management of liver diseases. I have to say that in Italy, we have a public healthcare system. So basically, those costs are referred to the public expenditure. So basically, for the management of liver diseases, in that year, they spent more or less, let's say, 15,000 million, which is more or less the 10% of the Italian health expenditure for that year. So the 10%. So it's a really, really great portion. So why we are, let's say, still at this point in which we have so many unmet clinical needs? Basically, most of the researchers, clinicians agreed in the aspect that during the past, the lack of samples, human samples, had really hampered the discoveries. If you compare other diseases, for example, I'm working in liver cancer. So if I compare what we have now as tools for the diagnosis or treatment with other cancers, such as breast cancer, lung cancer, or other types of cancer, we can say that liver cancer, the treatments for liver cancer are not really at the same level with other cancer. We don't have so many biomarkers that can guide, for example, the treatment as there exists for other cancer, or at least there are researchers, there are clinical trials, there are newly approved tools, biomarkers, and drugs that can be really used in a so-called personalized treatment. So why for liver cancer, for example, we are so late? Because we, as researchers, realized that there was a really lack of studies involving a reasonable number of samples. Because in my experience, when reading really impactful publication in science, in Nature, dealing with pan-cancer studies, I realized that when a tool, let's say a biomarker or a method, was proposed or was developed thanks to the study conducted in 2000, 10,000 lung cancer or breast cancer. But in the same study, when I was looking at the numbers representing the study in the liver cancer, I realized that they conducted the study taking into consideration only 100 liver cancers. So of course, I can think that the tool, the biomarker, the methodology they are suggesting can be really trustable when applied to lung cancer or breast cancer, but not really trustable when applied to liver cancer. So when the study was done in only 50 samples. So that's really an important aspect. That's why we need biobanks to collect and store samples that let us to conduct our studies in a number that can last to let us to obtain robust results. So that's why we consider biobanks a pillar in translational hepatology. So at the time, we decided to dedicate our biobank in the collection of liver samples and some samples collected from healthy blood donors. This is also important to have a reference. And we decided that the collection was aimed for biomarker studies. So this is important for the type of the sample you want to collect. So while defining the SOPs, also we set up our infrastructure with freezers, alarm system, barcoding system, and everything you need, of course, for storing your samples. We started the collection of different samples. We include, for example, liver tissue from hepatocellular carcinoma patients, from patients undergoing bariatric surgery. So we have also a cohort of obese patients, which we collect liver samples. And from those, we are also collecting serum, plasma, Buffy coat. The same samples are also collected from patients with cirrhosis and liver cancer. So these were the samples that we included in the initial collection, but of course, in the future, we plan to extend the collection to other diseases and maybe other type of samples. Important is the collection of associated data. So basically, the value of a biological sample that has no associated data is almost zero, because if you don't know from where the sample is coming from, you can't use the sample for your research. You need to know that that sample is coming from a patient with liver cancer, for example, that is a male. Maybe you need to know that is the etiology was related to some infectious disease. Possibly, you can add some biochemical data. You can add some scores related to the tumor itself, or some notions related to the lifestyle. More data you associate to your sample, of course, more value as that sample, because you can better describe the sample, you can better put in relation the sample with different outcomes, and you can plan different studies. So for example, for our samples, basically we collect from 20 to 50 parameters for each patient, depending of the disease. And when we perform some studies by using those samples, then we associate the molecular data to those samples. So then the biobank is somehow enriched by molecular data. So this is a really an important aspect, because then you can provide researchers who are asking for another aliquot of that sample your molecular data. So maybe they can take advantage of those molecular data for new studies. Actually, we are working another I consider really important activity. We are trying to integrate the biobanking system within the hospital informatics system. So in our region, we have a single institute, informatic institute managing the healthcare system. So what we asked, and now they are working on that, probably in say 1 year will be working the system. We asked to include the biobank, let's say, within the exams you can ask for the patient. So basically, as all the clinicians, when visiting a patient and while they are selecting the blood test or other tests that the patient will be asked to do, they can also include the biobank. So basically, then nurses, they know that they will print the labels for the biobank, they will collect some more samples, and then the samples from the biobank will follow its own on track. This will make, let's say, the biobanking system really integrate in the daily activity of the collecting center. That can be the hospital in this case. We are working as well in creating a network, what I like to define a global biobanking model. So what does it mean? Global, it's a word composed by global and local. Why this? Because collecting centers, they can collect the samples and then they can store the samples by itself, of course, if they follow the SOPs defined by a biobank, and if they follow the quality system. All the collecting centers, all these hubs of the biobanks, then they are connected in a single network, managing all the samples, all the data. So basically, this virtual biobank can let you explore which are the databases. So you don't need to centralize all the samples, which is really sometimes a waste of money, time, can be also a risky procedure for certain aspects. But in this way, by querying the system, you can easily understand that maybe you have 1,000 samples related to liver cancer patients. One is stored in 100 stored in one hospital, 200 in another hospital, and then 500 in another, and so on. And then basically you organize the distribution of those samples to the center which is asking for those samples. So what we plan to reach at the end is a really integrated system and virtually managed system in which can